Yes, Weber, you're audible. So just can you start your video chat as well?
Yes, sir.
Okay. So just a brief introduction about him. So Vaibhav is a graduate of GMCH 32 Chandigarh, and he cleared NEET PG in his first attempt, securing an All India rank 1. And Vaibhav is joining the prestigious PG at Chandigarh, MD Medicine through INICT. So Vaibhav, welcome to the Telegram live session. So nice to have you.
Thank you, sir.
And so, Vaibhav, just to start with, first of all, congratulations on joining PGI Medicine, a really good department. I hope your journey there will be very fulfilling. What I want to ask you, and what the rest of the students also want to hear, that in internship, right? You've read your main notes during your MBBS. Now you're in your internship. Which resource which resource to read now in internship, and how to make a schedule, like resource
Okay.
as in not a coaching, but the main notes, revision notes versus like that.
Okay, sir. So in this situation, when one enters the internship phase and has to summarize everything, I would say that if you have done main videos earlier during your MBBS, then you can definitely go through it 1 or 2 times during the beginning of internship, like for the initial 4 or 5 months. But if you have not seen any main videos till now, then it is not a good idea to start watching main videos now in internship. You can make a revision source, revision videos as your base, and then build upon it using multiple tests and a focused approach towards question bank for the important PYTs and the topics which you find are very frequently asked.
Okay, so if I summarize you, so if many students have taken subscription during MBBS, read those books, more watch main videos during their prof exams. So if you have done that good enough for preparing the same subjects in internship, just quickly go through the main notes also, and then switch to revision. But if you have not seen the main videos or the main notes, you're starting now. Good idea is to start with revision videos and revision notes for most of the subjects currently in the market, all platforms included, including Meded. I would say that revision notes and revision videos, cover all the important PYTs, especially in a tabulated form, right?
Yes.
Uh,
And sir, also if I would say that if even if you have seen the main videos, it would not be possible to revise the same notes again and again even in the last few months or days before the exam. So it would be better that you keep on concising it simultaneously in each subsequent revision into some short source right from the second revision or so, rather than doing it only in the last 10-15 days, directly approaching the revision video or notes in the last 10-15 days. You can keep building upon it side by side, and it would help in multiple ways. Like you would have knowledge of both the main notes and which you can summarize in your set of revision notes.
So how
So
did
that would also be
you
a good idea.
how do you suggest that a student does? Let's say वो revision videos पढ़ रहा है, he or she is now reading revision videos, revision notes, let's say. So where would you say to summarize it? In a test and discussion format? How are you saying it?
Uh, like, sir, if for a particular subject, they have both the main notes as well as the revision video notes. So, what they can do is that, first of all, they can go through the revision notes, and for the topics which are very frequently asked or the important PYTs, they can just quickly also go through the main notes. And if they feel that this topic is also very volatile and this can be asked because it is an important topic, they can just write it in a short format into the revision notes only. So it would be easier for subsequent revisions, and it would also cover more facts about that topic while
Okay,
revising.
so for example, I think I got what you are saying. Let's say cranial nerves. Cranial nerves is one important topic which is tough to understand and remember, and a lot of questions are also asked. So what you are saying is, for such topics like cranial nerves, for example, you read main notes, summarize it in your own way in a piece of paper or two pieces of paper, and stick that paper in the revision notes.
Yes, sir. And also, sir, it is also a wise idea to make short Telegram groups or a folder in your phone. Just click the pictures from main notes that you can revise it simultaneously with the revision notes. That is also a good idea. And in that way, also you can cover it during your breaks. Also, like you just have to see your phone side by side. So that is also a good way to summarize the main notes.
Yeah, I think this is one approach that my junior Aman, I don't know if you know Aman Tilak,
I know,
he
sir.
also secured rank 650 in INI-CET in his first attempt. And, he also said the same thing that what he had was single WhatsApp group for each subject. So orthopedics NEET PG, medicine NEET PG, anesthesia NEET PG had separate groups for each subject, and he used to put in important tables ka screenshot, important screenshot, images ka screenshot, whatever he thinks was important, not given in revision notes for quick easy revision before the exam. I think that's a very very good idea, which you all should take into account.
And also, sir, because in that format, if you have seen the main videos earlier during your profs, that some form of image-based memory also remains of the main notes in our memory. So by clicking these pictures, that also does not get rewired because of rewriting. So that also remains with us.
Great. Now, one very important question, Vaibhav, I want to ask you, especially this is something students ask me that they have read main video notes previously. Now 6 months are left for the exams. So, should they switch to revision notes and trust the revision notes for revision, or should they still stick to main notes and revise them?
Sir, I would say that if you have studied the main notes many number of times and you have uh, highlighted also and you have already concised it appropriate to the amount of time you have left, then it is a good idea to continue with the main notes. But if you have just read it one, two times and have not concised it at all, and but you have seen but you have not concised it at all, then it would be better to switch to a revision source, and then you can build upon it using the main notes for some important topics which are very frequently asked. But it would be definitely better to go to a revision source at that moment, this moment.
Yeah, so if you have highlighted PYTs in the main notes, that is good enough. But if you just read the main notes for concept building to understand the subject, then yes, you should switch to a revision notes source and trust that and build upon that. I think that is something that I
Yes.
also agree with. Yes. Now let's come to test and discussion. So Vaibhav, did you join a test and discussion?
Yes, sir. I gave a lot of tests from multiple platforms. So that was basically, I felt that would be more appropriate according to my level of learning to solve more and more tests, because theory content, I did not have much time also to go through the main notes again and again. So you mainly use the retrograde approach, solving the test and then revisiting the notes to see a few pointers related to that topic.
Okay. So let's say you have a you join a test and discussion. There is a test coming up. So
Yes.
how would you prepare for an upcoming test? Which source, not the coaching, but the reading source and the question bank? How would you approach that?
Yes, sir. So, if I am in my first set of reading for that subject, first I would go through the revision source of that subject which I am following. Like if I am doing surgery, I would quickly go through the revision notes of that subject first. Then, for some topics which are very frequently asked or the important PYTs, I will go through the main notes. If I have, like, it depends on how much days you have. If you have, like, say, a week, then you can definitely try this. But if you have only 2, 3 days, then it is not a good idea to see the main notes. So after studying the revision notes and then reading few important topics from the main notes, I would give the test and see the discussion video. And from that test and discussion video, if I feel that there are some pointers that are very likely to be asked, I would add that to the revision notes for subsequent cycle of revision.
Okay, so your consolidated source was revision notes. You had made sure that everything that I read extra will go into this revision notes.
Yes, like in this INFC November also, there was a question regarding to the laparoscopy angles, the elevation angle and azimuth angle, and that I had not read in my main notes, that I had not read anywhere else, but I saw. a test and discussion where it was discussed, and I had added it to the revision, so I remembered it directly and was able to answer this way. So, and
Right.
also it is not always important that you revise everything in last 10-15 days. There will be many things which will come in your background knowledge, which you have because of solving any test or watching any video discussion or just a YouTube live session of some important pointers before INICT. That may click your mind at the right time uh, if you are having a little bit of calmness in you while solving that. Jitna pad liya, it is okay. Now let's focus on giving a good exam.
Great. I think that is a very good take कि ठीक है what I suggest कि आप हर एक टेस्ट एंड डिस्कशन की अलग से नोटबुक बना लो you know if you are not someone who is very fond of annotating because you know students को कभी कभी दिक्कत होती है कंसाइज करने में एंड
Yes.
कंसोलिडेट करने में that takes a lot of effort एंड सो व्हाट आई से कि अगर वो नहीं करना तो एटलीस्ट जो टेस्ट एंड डिस्कशन की बुकलेट्स हैं या पीडीएफ्स हैं या आप खुद टेस्ट एंड डिस्कशन हाथ से लिख रहे हो किसी बुक में make each booklet for individual subject so that you know those are your resource to revise in the last 10 days.
Yes.
Now Vaibhav, let's come to question bank and pyqs. So how many year pyqs did you solve, when did you solve, and did you do the question bank along with it as well?
Yes, sir. Sir, for the main question bank, I would say that if uh, you are targeting the upcoming NEET, then it is not the right time to do the main question bank. Main question bank, if you are planning to solve it wholly, like the whole question bank, then either you solve it in your profs or do it very selectively during the internship part because the time is very limited and solving the whole question bank would not be high yielding at this point of time. So, if you are somebody in your second, third, or fourth year, then it's a good idea to just see the standard textbooks and also keep on solving question banks side by side, just for uh, having a good grasp over the concepts. But if you are targeting the upcoming NEET, then it would be better to either solve custom modules and selective question banks, or you can solve the tests, subject-wise tests, or mini tests.
Okay.
And
Yeah.
and so, what was the second part of the question?
pyqs कितने साल के
Yeah,
किए थे?
yes, sir. So for the PYQs, like when I was revising for the first time during internship, I initially solved the question PYQs of the last 10 around years. In the first cycle of revision, using the Reflex app, I solved it. So I tried solving as much MCQs I could during the first cycle, but definitely I was not able to remember much of it after that. And my duties were also getting hectic, so I did not do for another 3-4 months. I did not do PYQs. Then when the news was coming that NEET has got postponed from March to the July and June, so then I solved it one more time, PYQs. And I focused more on the INFCT PYQs this time because the May INFCT was upcoming exam. So I focused more on INFCT, and in that phase, I gave the whole exam like exam pattern only, like the 200 questions of the INFCT for the last 10 years. I gave as exam from 2012 to 2023 paper. So that was a good practice of the questions for me. And then it again got postponed. So in that time, I solved the NEET PG, FMG, and INFCT PYQs of last 5 years at that time. So it was a good idea to have a good grasp of PYQs of all the three exams. And even the UPSC CMS papers I solved when the NEET got postponed again. So that was also a good set of questions, especially for the clinical subjects. That was amazing. Like for obs, gynae, surgery, and medicine and pediatrics, it was a good set of questions. So I would suggest at least FMG, NEET PG, and INSPT PYQs you should definitely do. And if you find time, or if you just wish to see some video in your free time, then you can see YouTube UPSC CMS discussions side by side.
ओके या आई थिंक दैट इज वेरी इंपॉर्टेंट एंड एफएमजी के भी करने हैं बहुत सारे स्टूडेंट्स थिंक दैट एफएमजी के क्वेश्चंस नहीं करने नीट पीजी एनआई के करने बट एफएमजी नीट पीजी का ऑलमोस्ट सेम लेवल हो गया है यार ठीक है
Yes, sir. There is a lot of overlap in the topics. FMG, especially for the clinical subjects like surgery and all. there is a very much similarity between the subjects, between the both exams.
Right. Now let's come to grant tests. Okay, grant tests, how frequently did you used to give during your initial phase? Let's say you are starting your internship. अभी T&D test and discussion start हो रहा है. How frequently did you give grant tests?
Yes, sir. Sir, I gave grant test regularly, like throughout the preparation phase, and because that was my favorite tool to learn, like I really enjoyed that. So, but it is not like you give every day a grant test. That is not a good idea. Uh, in the initial phase, like during the initial 4 or 5 months, I gave it twice a month, every fortnightly. I used to give. Then, when then as the exam approaches nearby, it is better to give once in 10 days till a definite exam date is in front of you. Then, when exam comes very close, like in the last 2 3 months, you can give every week. I think that is the right frequency, and even twice a week is okay in the last 1 2 months. But I think at this stage, when 6 months are left, if we consider it to be the actual date, it would be better to give it every once in 10 days would be okay.
All right. Okay. So yeah, once in 15 days, once in 10 days, whatever you feel. If you think that maybe तुम्हारे subjects कुछ weak है, I think once in 15 days is a good frequency.
Yes,
And especially once 5 6 subjects get completed, तब थोड़ा सा frequency you can increase.
increase.
And initially grant test का the main aim is not to get a good rank. The
Yes,
main aim in giving a grant test is to sit for 3 hours. Okay, and
yes,
build
sir.
a habit of sitting for 3 hours. Initially, when you're giving a grant test, just make sure that the subjects which you have read, let's say path, pharma, physio, biochem, and art is done, and you're giving a grant test. So these subject questions, try to analyze where you're getting
Yes, sir.
mistakes, right?
Yes, sir. Reviewing the grant test is like very important part. After the grant test, I used to take a A4 sheet of paper and write what kind of mistake I am making. Is it a silly mistake? Is it the guesswork which did not work? And was it a conceptual error, factual error? And that kind of analysis helps you to revisit your notes again and see whether it was a recall error or whether it was something new you should know or whether it was just a fact which you should not know only. So that kind of analysis also helps. And definitely grant test is a very nice way to practice MCQs in a time bound manner. Because if we are solving the question bank directly, we keep on marking the answer and seeing the solution. So in that way, there is no management of the time and the speed is also not appropriate. And the think time in the exam, we have very less time to think and analyze whole question and see all the options and mark the right answer. So that kind of habit we can only build if we are practicing subject-wise test and grant tests regularly and not by the question bank.
All right. Now, last question, Vaibhav, before we wind up today's session and take questions.
Yes,
6 months are left. What should be the timeline of completing everything? How much revisions? How would you plan the next 6 months for, let's say, one of your juniors?
yes, sir. So, sir, if we are thinking that if we are planning for the NEET PG 15 June or the May INICT
15 June NEET PG.
15 June NEET. Sir, I would say that in the next 3 months till the March, you should focus on one big cycle of revision in which you will do the revision notes thoroughly and also add some amount of information from the main notes and PYQs to the revision notes. Then one cycle you can plan till for the next 40 days or so, and then and revise the whole revision notes once again and solve the important PYQs or the bookmark PYQs again. Then one cycle you can plan before the May INICT of 5 10 days or 7 days and try to give a good attempt at that. And then uh, one one more cycle of revision before the NEET PG. In that way, you can also see where you are going wrong while solving the exam via the May INICT attempt, and that would help you to focus more on those areas which you are lacking it in the exam solving ability or in the time management, and then practice more grant tests uh, on trying to improve those aspects and then giving a good exam on 15 June.
Yeah, I think let's make INICT our main exam. try to give INI-CT as a real grand test. Okay, a
Yes, sir.
serious attempt at INI-CT is must for all the Sankalp NEET PG students.
Yes.
Okay, what our strategy will be after INI-CT is to increase the frequency of grand tests, because by then you would have completed 2 cycles of revision, and after INI-CT we'll focus more on the retrograde approach to revising a subject, right?
Yes.
Giving grand test every week, reviewing it, and just reading the week topics of the grand test in the coming week, again giving a grand test till the NEET PG.
Yes.
Right. So that's all. I think we have covered almost everything in today's short video. Thank you, Vaibhav, so much. If there are any questions amongst the participants, please unmute yourself and ask.
Hello, sir.
Yes,
Hello.
Selva. Yeah.
Sir, first of all, congratulations, sir. Your place is something where all students are dreaming about.
Thank you,
So
Selva. Thank you. Thank you so much.
I have one question, sir. Sir, is there anything like you find these mistake in other people's preparation, but you never do that in your preparation?
Yes, sometimes when we are studying in an environment where a lot of people are studying, then sometimes there is a FOMO of what other person is doing, and if learning from their mistakes and like, but sometimes it is important to focus on your own preparation and just trying to improve yourself each day at a time, and in that way uh, a lot of overthinking which sets into ourselves while preparing gets cancelled out. So I would say that if you are somebody who is discussing with other people and have a study partner or so, then it is a good idea to learn from each other's mistakes and improve. But otherwise, it is better to try to improve yourself and be a better version of yourself each day by putting how much effort you can and not comparing with others.
Okay, thank you, sir.
Very well. Yeah. Any other students? Yeah, please unmute.
Good evening, sir.
Good evening.
Sir, it's like main videos from one source and revision videos from other sources better, or it will lead to confusion.
Uh, in this way, this part, I would like to say that if you're talking about the main videos and revision videos of a particular subject, then it is a good idea to see it from the same source. Uh, but if you are saying that there is a single booklet in which you have to consolidate everything, then it is okay if you are changing the source also, because that is a very ultra crisp source of revision, and that is only meant for last 10-15 days and not for like the whole 1 year of your preparation. So in that way you can consolidate everything into a single 20th notebook, which you can prepare yourself also, or you can use some printed book also. But if you're talking only about the revision video notes, then it is better to stick to the same faculty.
Okay, thank you.
Well,
Hello, sir. Good evening.
good evening.
Sir, during our UG days, we often read the standard textbooks. For example, I read the J.B. Sharma obstetric, listening the suggestions from my senior. So there are many flowcharts and like for ectopic pregnancy management and different management guidelines according to the flowchart. So should we add those charts in our other notes, or it will make unnecessarily redundant?
Um, like I would say that it is a good idea to incorporate those, but that would be very much time consuming. Like you would
Yes.
not be able to revise them again and again, and might not be able to revise it in the very last phase, last 10-15 days. So if you have revised it multiple times, like you have solely focused on that during your profs and revised it multiple times during your profs, then it is a good idea to just click their pictures and keep in your folder in your phone and revise it towards the end. But if you have seen only 1-2 times and like you're not like you don't remember it pictographically the whole of it, then it's better to just let it go and focus on your notes which you are currently reading.
Okay, sir. Thank you, sir. Thank you very much.
Well,
Good evening, sir.
good evening.
Sir, I wanted to ask that during the first read, were you able to complete 100% of a subject? For example, if you're doing patho or surgery, were you able to complete 100% of a subject? Because I have only been able to cover about 70% of the subjects that I have done, and I'm not feeling very confident because of that.
Um, yes, Asa, that's a very valid question, and I was never able to complete any percent. Anything which I uh, planned, like not even close to 70%. Mostly, I used to just focus on doing the important stuff first, and if time is left, then just scrolling through whatever is left. And like it was never like I am starting from the first page and covering whole cover to cover the notes. It was never the case of that. So I would say that first focus on even if you are reading the main notes, first focus on important topics, the frequently asked topics, important PYQs and PYTs, and then you can just scroll through the pages to have a recap of whatever you had earlier seen.
Thank you, sir.
Welcome.
Sir, in the main INCT NEET PG exam, you mark everything, most of the questions by guessing, or you already know the topics of each question?
Uh, all the questions I did not know, like it is important to know majority of the stuff, like around 60% it are from directly the notes which you are revising the last few months. But definitely all the paper is not from what you have read in the last few months. So in that case, the long-term memory, the memory from your main notes or from your lectures in your college or from the clinical postings you attend or just the work you're doing in internship and you're discussing with someone that comes in your mind. Like many questions are practical based and they do not require you to read the fact directly from a book. They are just based on some basic clinical acumen and not based on the theory which you read in textbook. So for that you need to have a calm mind, and that would only come if you just feel that whatever I have read is okay, and but I will try to mark the questions which come directly from it right, and whatever will come outside of it, I will try to think about it during the exam with a calm mind.
Hello, Dr. Vaibhav.
Hello.
Yeah, my question is how to keep revisiting a subject multiple times during the preparation journey, or should I revise the notes again and again, or switch to subject-wise test to revisit or revise after the first read? Thank you.
Uh, in this case, I would say both the approaches are good. If you revise it from the notes and then solve a test, that is also a good approach. And giving a test first and in a retrograde approach, where revisiting your notes is also good, but it all depends on how much time you have. If you are working, if you are an intern or you're doing a job somewhere, then the retrograde approach is definitely better because time is limited. And in that limited time, you will be able to visit the more frequently asked and more high yielding topics in a better way using the retrograde approach. But if you're not doing a job and you're just wholly preparing for the exam, then I think the other approach is also good enough.
All right, thank you.
Welcome.
Good evening, sir.
Good evening.
Sir, I have this, like I'm an intern. I'm left with about 3.5 months of my internship. Can you tell how did you manage preparation during the hectic postings of your internship?
Uh, yes, that's a very valid point for all the interns. Like uh, sometimes it feels very overwhelming to manage studies, and we are not able to wholeheartedly focus on any one thing. So in this case, I just used to follow that. Just keep going and don't leave the studies. Whatever time you're getting, like even if you're getting 1 or 2 hours in a day, just solve few MCQs during that phase and just see whatever photos you have clicked and from the main notes in your phone. in these situations, these things help a lot, like having small snippets to revisit. That is a good idea rather than leaving the studies at all. And definitely, you can also plan to take allowable extension from your internship according to how much time you have between internship and the eligibility date. You can plan your extension accordingly from the hectic duties.
Yeah, I
Okay,
think
sir.
you extended your internship before the March wala uh,
But that
NEET PG.
backfired, sir, because the PG got postponed. So
Yeah.
that was not a good idea for me. But it worked anyhow. So it did
Yeah,
not
what
matter much
I
in the
would
end.
I would also like to add here. So let's say your internship, you are having a hectic internship, or the postings in the internship currently are hectic. So what I tell students is keep in a hectic posting, don't keep a major subject. Like
Definitely.
don't plan on revising a surgery or obs gynae during your, let's say, a hectic posting. Shift to a minor subject. Okay, anesthesia, psyche, derma, which you can, finish. So you will A, finish a subject, and B, you'll get a sense of completion, and C, you will get okay, I'm moving forward. Okay, so if your subjects keep on getting completed, even if they are very small subjects, you get a sense of completion. That's what I recommend in a hectic posting.
Okay,
Yes.
sir. Thank you, sir.
So if there are no more questions, I think we'll call it a day. Any more questions? Please unmute. All right. So, Weber, thank you so much for joining in.
Thank you,
And
sir.
again, congratulations on joining PG Chandigarh Medicine.
Thank you so
All
much.
of us wish the best for you, and hope you also, your MD is, चलो toxic तो होगी थोड़ी, but it is a good learning experience, and DM में भी तेरा हो जाए selection.
Thank you so much, sir. Thank you,
ठीक है.
sir.
So any guidance regarding PGI, whatever you need, any contacts, you let me know. I'll be happy to help. And
Yes, sir.
let's hope कि कभी future में again we call you on this group for some valuable insights.
Sure, sir. Thank you so much, sir. And sir, even if you get to visit Chandigarh, then surely I would like to meet you and
Done.
share some moments with you, sir.
Yes, yes, पक्का. If I visit Chandigarh, I'll ping you. पक्का. Sure.
Thank you, sir. Thank you.
चलो, okay. All the best, Vaibhav. Bye bye.
Bye. Thank you.
Okay, so I'm ending this chat for everybody. ठीक है, I'll see you tomorrow at same time 9 p.m. Tomorrow, Dr. Siraj sir will take a short pharmacology topic. Same time 9 p.m. Tomorrow. Okay. Bye bye. Good night.